Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations. Today is November 23rd, day before Thanksgiving, and we're doing this a little early this week so that people can get this in before the holiday, because we do have some travel advice, and we do have some questions today, and we'll get to those in a bit. If you do have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org, and we'll get back to you with the answers. So COVID in the world is actually pretty quiet right now. In the world, we're not seeing any real big outbreaks. There is some increased amount of disease in the Pacific Rim, in Japan, South Korea, Taiwan, and then a little bit in Australia and New Zealand, but not a lot of deaths from this because they have very high vaccination rates in those areas. In the US, the number of cases is fairly stable. And in Oregon and locally, the number of cases is pretty stable. We're still seeing 10 or 20 cases a day reported to us, and we likely have more cases out there, but certainly not the huge increase that we'd seen in past winters. We still are having some hospitalizations between 5 and 10 per day. And on those hospitalizations, they're really striking in that these are people who usually have not been vaccinated at all, or if they were vaccinated, they've not had a booster in a year. So what we have seen is that for those people who've gotten the bivalent booster, we've not seen a single person who has been hospitalized or die. So the bivalent booster appears to be very successful in both preventing severe disease and preventing death. So our recommendation is certainly to go out and get your bivalent booster. But the big news in this last week has not been so much COVID, but has been influenza and RSV. So influenza and RSV are things we've known about for years. They go around each year. But over the last 3 years, because people were wearing masks and staying home when they were sick, we've had very low amounts of influenza and low amounts of RSV. And this year, because people are visiting again and not wearing masks, we're seeing a real explosion in cases. And so in the Southeast and the East Coast, influenza and RSV is really a problem. I met last week with some friends from Massachusetts, and they'd said that the hospitals in Massachusetts are totally full with kids with RSV and influenza. And in fact, in Boston, a place that has really a lot of hospital beds, they need to send people as far away as Washington, D.C. to get a pediatric ICU bed. In the last week, it started to hit Oregon, so we've seen a lot of influenza A and a lot of RSV. I saw a bunch of them yesterday in the office, and these kids are sick and miserable. None needed to be hospitalized, but OHSU is on emergency status because of all of the cases that they've seen. I talked to a family that was in the emergency department the other day. They said there was a 12-hour wait up at Riverbend because of so many people with influenza and RSV. So it's really out there. The good news is that we do have a vaccine for influenza. The vaccine seems to be very effective this year, really a good match for the influenza A that's out there. So I'd really recommend that people get their influenza vaccine. For RSV, there is no vaccine and there is no treatment. And so our recommendation for that is stay home when you're sick. So a bunch of the kids we've seen with this have been in classrooms where there have been a lot of kids sick with stuff. And really, this is the time of the year that if you're sick with something, please stay home if you're sick, and please have your kids stay home if they are sick. So our recommendations haven't changed very much. So our recommendations are several. First is if you're sick, stay home. And especially as we get to the holidays, if you're sick, please try not to travel, because when you travel and visit grandma and aunts and uncles and you are sick with something, you can certainly go ahead and spread it. The second is if you are sick, when you stay home, in a day or two, get tested. We're recommending that at all ages, if you have symptoms, to get tested for COVID and for flu. And for kids less than 5 or adults who are sick enough to be hospitalized, to also get tested for RSV. The other is certainly to go ahead and get your booster shots for both the COVID and for the flu. The question this week is, can you get them both at the same time? Will that affect the immune response, or is there any advantage to waiting, or doing in other arms? Theoretically, there may be some advantages to separating it in some ways, but practically, just get them. When I got my vaccine, I got them at the same time, and really didn't cause any trouble. So please go ahead and get your boosters, both for COVID and for flu. And if you're sick, stay home. If you're around a family that has this RSV, just be cautious, because RSV can really be quite an issue, especially for young babies and for preemies. So over the years, I know a lot of ex-preemies who at 2 or 3 months would get RSV and get really sick, wind up getting hospitalized, be in the hospital sometimes for days or weeks until they got better, because there is no specific treatment. It's just all supportive. So overall, things with COVID are going pretty well. The second question we had this week is, how do you know when the pandemic is over? So, we've used the weather analogy a lot, right? So we've used the weather analogy that, when we predict COVID, we're telling you what goes on, and we can predict a little bit into the future, but it's really hard to go ahead and predict far into the future. So our best prediction is that if there are no new variants that are out there, that the COVID pandemic is ending, meaning that we're not going to be in a time where we're overwhelmed or have a lot of hospitalizations, but it's not going to be totally done probably for years. We're likely to have low numbers of cases of COVID for several years. The other issue, though, is about new variants that show up. We've had a bunch of new variants, the BF and the BQ, but they don't seem to be particularly contagious or particularly worrisome. But those are things we'll watch. But I have to remind you that at this time last year, so November 24th of 2021, we were saying, look, we're looking pretty good. There's no new variants on the thing, and things are great. And then that afternoon, there was an announcement from the World Health Organization that there was a new variant called Omicron. And so it was just a year ago today that Omicron was announced. And then, we had this terrible time then this last year with Omicron. We had our most number of cases, and for Douglas County, our most number of deaths related to the Omicron outbreak. So if there are no new variants, then that's going to be, then we may be nearing the end of the pandemic. But if there's a new variant, especially a new variant that does not respond well to the vaccine, we could be in for some more time. But right now, things are looking pretty good. So our best advice is, stay home if you're sick. Please don't travel if you're sick. If you are sick, get tested for flu and COVID. If you're positive, to talk to your provider about getting an antiviral agent, and stay safe. Looks like we have another question. So why wasn't stay at home if you're sick enough to get us through COVID without the big shutdown? If it's so effective for RSV, wouldn't it have worked for COVID? And the answer is probably not. So flu and RSV are contagious, but they're not that contagious. The other issues with flu and COVID is flu and RSV is you pretty much know when you have it. So for flu, there's a really rapid onset of symptoms. And so most people have the flu can actually remember the hour it started. So what they say is, I went to school, I felt great. And in math class, I had no symptoms at all. But by science, all of a sudden, I felt really terrible. And I've had a flu a few times, and it's exactly true. You can remember the hour it started. And you tend to be most contagious with the flu once you have it, rather than before. And so most people know they have it and they're sick and they stay home. Certainly with RSV, it's sort of slow to come on, but when you have it, there's no asymptomatic phase. The problem with COVID is that COVID is most contagious before you have any symptoms at all. And so stay home when you're sick with COVID didn't work, because people who stayed home when they were sick may have given it to people before. And that's why we did need to do things like lockdowns. That's why we did need to do things like masks, because the symptoms of COVID come after your maximal infectious period. And what we've seen when we carefully investigate outbreaks is that a lot of times people went to work on, say, on a Tuesday, felt perfectly well. Wednesday, they started to have symptoms. And unfortunately, then they went to work on Wednesday, and then Thursday, they tested positive. So by them staying home when they were sick, we prevented those they infected on Wednesday, but probably not those that they infected on Tuesday. So, but for COVID, staying home and when you're sick certainly helps, but for flu and RSV, it really helps. And so really, if you're sick, stay home. Do we have any more questions, Brian? Nope. If you do have questions, send them to us at Facebook questions at douglaspublichealthnetwork.org, and we'll do this again next week. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County.